name's Elisa, and I am going to show you how to wrap a surgical gown. First, you have your supplies. We've got a surgical towel, 2 muslin wraps, a gown, and I am going to make sure to check my size, which is a medium in this case. And then we've got our autoclave tape, 2 sterilometers, and a Sharpie. Make sure that everything is clean, that there's no blood, fur, or anything else that shouldn't be on there, and no holes either. And then we will go ahead and wrap. So we've got the gown, and be sure that it is not inside out, and you can tell that by looking at the sleeves. There's no seams. Okay. You're going to end up putting your gown on, whoops, drop that, put it on this way. So you want to basically dress the table, is what some people say, so the table is like you. Okay. And then we'll wrap it sort of an accordion style, so I'll start with the sleeves and bring them in. Other sleeve. And we'll start with the sides. And you want to wrap this as neat as you can so that when you put it in the autoclave, the steam will penetrate everywhere and nice gown. And then we're going to go ahead and fold it in again. So we'll have a nice sized gown. Now here's the tricky part. When it comes to folding it this way, you want to be sure that this gets folded over, okay? Not under, over. If it gets folded under, you're going to end up putting it on incorrectly when you open it. Okay? So we'll wrap this over. Okay. Then you can finish the rest of your accordion process. Now we will take our surgical towel and we will fold it like an accordion as well. And we'll accordion this way and make a little tab. It's going to be important when it comes to picking it up to dry your hands off. Put the towel on top. We'll take one sterilometer strip, place it in the towel, and take the other one, place it midway in the surgery gown. Now we can go ahead and wrap. We'll take our first muslin wrap, and we'll place our gown inside. And it is important to face the gown away from you, and also important to start by taking this first flap, folding it away, and that's going to ensure that when you open this pack, it'll be opened sterilely. Okay. And we'll take this, fold it, and we're going to make some flaps. Again, very important to make these flaps because when you go to open it, you need to be sure that you're opening from here so that when it opens, you're not touching the sterile side, you're touching the outside. Flaps, and then we'll take one side. Again, be consistent. I always do my left side first, and then my right side, and then we'll take this one, fold it over, tuck it in here. Then you're going to take your second wrap, and when you open these, you're going to have to open them in the same manner. So in order to do that, you're going to take the tab of the first one, place it towards you, and then wrap this one the same way that you did the first one. This is very important because when you go to open it, you want to be sure that the contents inside remain sterile for whoever's putting on the gown. And that'll be talked about in another video. Okay. And then we'll take our autoclave tape, and I already have a courtesy tab on this end, which is nice. So when it comes time to open it, you just grab the tab and then pull away from you. Okay. And on our autoclave tape, we're going to write what's inside. So I have a medium gown. Some people put medium gown and towel. We'll just do medium gown. So contents, we need our initials of who wrapped it. And then I'm going to go ahead and autoclave this today. So I'm going to put today's date on it. And some people will put the expiration date on it instead. That just depends on what your practice decides to do. And now we can go ahead and place it in the autoclave.